One of the areas where the Uniformed Services University of the Health Sciences distinguishes itself is through its use of healthcare simulation. Research has shown simulation to be an effective tool for medical education, and USU is utilizing it in advanced ways. These simulations are designed to look and feel real, often amazingly so, but there are no lasting consequences if things go wrong. This kind of risk-free learning is one of the major benefits of simulation education.
USU has really embraced using simulation as an educational platform and seems to always be kind of expanding curriculum opportunities to use simulation for medical education.
USU has pushed the envelope in this area both through its very own simulation center, an advanced facility a variety of university programs utilize, and through advanced simulation applications at the school's field training exercises. The school's biggest exercise each year, FTX 401, formerly known as Operation Bushmaster, takes place at an Army National Guard training base in Pennsylvania, where fourth-year medical students portray doctors and first-year students act as patients.
What I've done is combine first-year student actors with the high-fidelity simulators, the SimMan 3G, and these are simulators that can breathe and can bleed and have vital signs and have pulses, and so the fourth-year students who are treating the simulators get the chance to be able to treat first-year students, and then later on in the scenario, treat an actual simulator that they can do invasive procedures. So it's pretty hard when you're taking care of a first-year student to actually do an intubation or use a knife to do a procedure, where they can do all those things on the simulator and get a chance to practice more advanced medical care.
Another key part of USU's simulation program is its very own facility, the Val G. Hemmings Simulation Center, which is one of the world's most advanced medical education and training simulation centers. The 30,000 square feet center, located in Silver Spring, Maryland, is used by students and faculty for many purposes, from honing surgical skills in bedside manner to practicing frontline care in field hospitals or in the trenches. One of the simulation center's top leaders describes its mission.
There are really several parts to the job. The main part is focusing on the medical students, the nursing students, actually every student at USU's, and making sure that as simulation relates to their educational experience, because the requirements for that just keep increasing, and we're finding out more and more how critical it is to their educational experience. So we spend a lot of time focusing on how we can meet those needs for all of our students.
At the Sim Center, the patients not only look and feel real, but so do the environments in which the students are placed.
So we do have something called the wide area virtual environment here, and it's an immersive environment. It's as big as a basketball court. You're surrounded by large screens. You're actually in a 360-degree environment. You have the opportunity to go in and practice, but in an environment that's a little bit more realistic. So we can have a combat operation going on, you can be in a hospital, you can be in a helicopter. And it gives us the opportunity to add those additional stimuli so that when we're practicing for healthcare, we're doing it in a more realistic environment.
For years, USU's Simulation Center has been a model for other medical programs starting their simulation efforts, and every year it continues to break new ground in its field.
Our simulation center here at USU's is absolutely one of the best in the country. It gives us the opportunity to do cutting-edge research. We have things like the wide area virtual environment, and we have such an integrated standardized patient program that every student that comes actually gets that experience in their first year. We also have the opportunity to practice procedures and to get people ready for medical school in ways that just a lot of places don't.
Similarly, USU's Bushmaster Exercise is one of the largest and best medical simulations in the world.
It's a really large-scale activity. There's hundreds of people involved. There's a couple hundred students that go out there and are educated during the Bushmaster Exercise. So it's really a world-class activity in terms of scale and the scope of what we're doing. I think that the newer things that we're adding are really increasing the quality of the training that's taking place. So not only are we allowing students to learn about the logistics of an operation going forward and leadership techniques, but they're also able to learn about real-world medical skills as well. And so we're combining the medical training and leadership training that are really important for officers who may be faced with these challenges in the real world in the future.
USU maintains its leadership in simulation education by constantly looking to improve its program and incorporate new cutting-edge features. For example, recently the Military and Emergency Medicine Department began using human-worn simulators, or cut suits.
An actor puts on kind of a big fake chest, and they have plates on that protect them while they're wearing it. And then the actor can act like somebody who's injured, so they can yell in pain, they can ask about the wife back home. They can do all these kind of things, roll around on the ground while somebody's taking care of them. The student who's taking care of them gets to practice actually talking to a person who's hurting, who's scared, while they can do invasive procedures.
Along with USU's field exercises and its simulation center in Silver Spring, the university also has a patient simulation laboratory on campus used for student, resident, and faculty training. Here, users practice operating room teamwork and communication, along with anesthesia techniques and a variety of other skills. USU staffers are even pioneering new technologies in the field. The Sim Center's Dr. Shad Deering developed a groundbreaking obstetric emergency simulator used throughout the Department of Defense.
Here at USU at the Simulation Center, we like what we're doing, but we're never completely satisfied. And because medical simulation education is a new field, there's so much opportunity for research. Everything from trying to look at how to best implement it in a field exercise, such as Bushmaster, to how we can use technology and the new simulators that are coming out to provide the best educational experience. We're also looking at standardized patients and interactions and communication and teamwork, with the goal being we want the best trained graduate and we want the highest level of patient safety possible.